Okay, when you think about managing diabetes, what's the first thing that pops into your mind? For most of us, it's blood sugar, right? But what if that was just one piece of a much larger puzzle? Today, we're diving into the latest official standards of care to really uncover the full, comprehensive picture of what modern diabetes management is all about.
So, let's just get right to it. This is the question at the heart of daily management for millions of people. Is this whole journey just a numbers game? Are we focused entirely on keeping those blood sugar levels tucked inside a specific range?
Well, according to the American Diabetes Association's most recent guidelines, the answer is a big, resounding no. While yes, controlling blood glucose is absolutely critical, don't get me wrong, it's only the beginning of the story. The real goal is so much broader and honestly, way more ambitious.
So, if it's not just about sugar, then what is it about? What's the ultimate goal here? This brings us to the core philosophy that's really reshaping modern diabetes care. Moving from that super narrow focus to a whole person view of health. And the answer, coming straight from the source, is surprisingly simple but really profound. The official goals are twofold. First, to prevent or at least delay the complications that can come with diabetes, and second, to optimize your quality of life. You see, it's not just about living longer, it's about living better. Okay, so how do we actually get to these big picture goals? Well, the guidelines are pretty clear that the old model, where a doctor just gives orders, is completely outdated. Now it's all about building a team, with you right smack in the center of it all. This new kind of relationship actually has a name: person-centered collaborative care. Think of it as a partnership. It's where you, your family, your whole health team, you all work together to create a plan that actually fits your life, your values, and your personal goals. You're not just a passive patient anymore. You are an active, essential member of the team.
And this cycle you're seeing, it shows exactly how that partnership works, day to day. It's a constant conversation. First, your team works with you to assess everything: your health, your lifestyle, what's important to you. Then, you agree on a plan together. Next, you go out and implement that plan. And then, this is the crucial part, you regularly review it to see what's working and what's not, and you adjust as you go.
All right, so that's the big idea, the philosophy. But what does this actually look like when you walk into the clinic for a checkup? Let's get practical and talk about how this all comes together to build your annual health blueprint.
You can really break the process down into these 4 key steps. It all starts with a really thorough risk assessment for things like heart disease, kidney issues, neuropathy. Based on that, you and your team set very specific, personalized goals. Then you create a treatment plan, and finally, make sure you're getting connected with any specialists you might need.
And this is so important. A really comprehensive checkup is way more than just a simple A1C test. I mean, every single visit should involve checking your blood pressure, your weight, and going over your glucose data. But once a year, the evaluation gets much deeper. We're talking dilated eye exams, comprehensive foot exams, and detailed lab work to build that complete picture of your health.
You might be wondering, okay, but why all these extra tests? Why look so far beyond blood sugar? Well, this next part is all about connecting those dots and showing why this broad, proactive view is so absolutely critical for your long-term health.
Whoa, take a look at this number. Over 70%. That is the estimated percentage of people with type 2 diabetes who also have a condition called metabolic-associated steatotic liver disease, or MASLD. In simple terms, it's a buildup of fat in the liver. And here's why that's a big deal. It's often totally silent, no symptoms, but over time it can lead to serious scarring and damage to a really vital organ.
So, because this is so common and can be so damaging if it's just left to do its thing, the new standards of care recommend a simple screening called the FIB-4 index. The great thing is it can be calculated from blood work you're probably already getting, and it helps catch potential issues early, long before they become severe. It is the perfect example of being proactive. And the liver isn't the only unexpected connection. Look at this number. It really shows why we need this wider view. People with type 2 diabetes have a 1.79 times higher risk of a hip fracture. That is a huge increase for an injury that can totally change your mobility and independence.
And the why behind this is just fascinating and a little counterintuitive. See, for most people, fracture risk is tied directly to low bone density. Makes sense. But for people with type 2 diabetes, the risk is way higher, even with normal or even higher bone density. So what does that mean? It means a standard bone density test might give you a false sense of security. And that's exactly why these guidelines push for a deeper look at bone health, to catch this hidden risk before a simple fall turns into a life-changing event.
So, after seeing this whole picture, from the collaborative care team to checking on your liver and your bones, what can you do with all this? That's really the most important question, isn't it?
Let's just boil it all down into 3 simple but really powerful takeaways. First, your care should be a partnership. You're an active decision-making member of your own team. Second, your care has to be comprehensive. It's got to look at your whole health, way beyond just blood sugar. And third, your care should be proactive, working to find risks early, not just reacting to problems after they've already shown up.
So I want to leave you with this thought. Knowing now that your care is supposed to be this collaborative, comprehensive process, what's one question that all this inspires you to ask your care team at your very next visit? Just thinking about that question, that's the first and honestly the most powerful step you can take on your health journey.